Hi, welcome to Backchat, where I get to talk to some of Britain's leading health experts and ask them for their top tips and advice on your behalf. Today I'm here with Kam Sowman of West London Physiotherapy Clinic here in Kensington. Kam, can you tell us a little bit about your background and the range of therapeutic techniques that you use for your patients?
Yeah, of course. I've been a physio for about 20 years and I studied in Otago University and sort of played a lot of rugby and rowing and sort of got into physiotherapy because of my love for sport. And I studied for about worked for about the first 6 or 7 years in the public hospital system, both in England and Australia. And then after that, for about the last sort of 14 years or so, I've worked in private practice, musculoskeletal, concentrating a lot on spinal, back conditions, postural related pain, taking out workplace assessments in the City of London, and just sort of building my knowledge from there. The therapeutic modalities we use for back and postural related pain is sort of wide and varied, and you learn a lot as you get more and more experience. Probably the main way to focus on it is probably modalities and things we use in the clinic, manual therapy to normalise tissue, and then probably the exercise-based part of the treatment, and then the lifestyle changes and the workplace assessment. So if you break it up into 3 categories, then pretty much you can resolve most spinal postural related pain. So the manual therapy side, the sort of treatment modalities we use is massage is a big one, which involves both deep tissue, soft tissue and trigger point therapy. Then we use acupuncture a lot to reduce sensitivity, mainly in muscles around the spine, and we use mobilizations and manipulations as well to loosen up joints and ribs and things in the spine. And lastly, to a lesser degree on acute related injuries or sort of very severe related injuries, when you can't massage, you may use ultrasound to try and reduce muscle tension and swelling as well.
Okay, so you briefly touched there on acupuncture. I know not many people have tried acupuncture, so can you explain a bit more how you use that in your practice?
Yeah, so acupuncture is another tool we use to relieve muscle tension and stiffness. It's not for spinal related pain. We don't use it a lot on the joints, okay? We mainly use it on the muscle, and how it works is 2 areas. One is when you stick a needle into muscle tissue, you'll evoke a local response and you'll evoke a central response from the brain, okay? So by combining both of those, usually we can get more of a relaxed muscle, which may be instant, or it may occur over sort of 24 to 72 hours as the blood flow increases into the muscle and the trigger points in a muscle, which is obviously the neural sensitivity of a muscle, those knotty areas we feel. Acupuncture can help reduce the sensitivity of those and normalise those, which will in turn release muscle tension and pain. The way we look at acupuncture, probably just to briefly touch, is there's 2 types of acupuncture, so it's important people know what acupuncture they're getting. Yeah. So we've got Western acupuncture and Eastern or Chinese acupuncture. So when you go and see a physio, generally you're going to get Western acupuncture, which is research based, and usually it's putting muscle into a tissue to get a response. Chinese acupuncture obviously works on balancing your meridians, your yin and your yang generally, and that's where you'll get needles all over the body. And that's obviously not research based. So I'm going to touch on the Western acupuncture because that's what I know how to do. Yeah. So usually when we stick a needle in a muscle, you'll only leave the needle in there for roughly 2 minutes. Okay, so it's not stuck in for very long, and just they believe 90% of the effect of acupuncture comes just from sticking the needle into the tissue. So it's very quick. Yeah. What we've seen with research is 60% of the population respond positively or negatively to acupuncture. 20% of the population don't respond to it, and 20% of the population have a very strong effect to acupuncture positively, and that's whether they believe in acupuncture or not. So it is worth trying if you haven't tried it, and it's something we discuss with the patients if they would like to try it. And as I said, it's another form of relieving tissue.
Yeah, it's great to understand those differences. Yeah, and you briefly touched on ultrasound for when people maybe not benefiting from the massage quite yet.
Yeah. So in acute symptoms, which we don't see a lot of acute symptoms in postural spinal related pain, usually it's gradual. Because it occurs over years and years of leading a sedentary lifestyle, sitting poorly and things. But every now and then we do get an acute back pain, and if it is too acute to massage or there's too much muscle spasm, usually within the first 24 to 72 hours of an acute injury, we can use ultrasound. And the way ultrasound works, it puts ultrasonic waves through tissue. So we've got diagnostic ultrasound, which is what you have when you obviously, you're looking at a baby or looking at tissue or something, the diagnostic. Then you've got therapeutic, which is what we use. So therapeutic just works on a different frequency from diagnostic. And what you'll do is you put in ultrasonic waves through a tissue, which stimulates the cells in the tissue and increases blood flow, which acts very similar to massage, but just that you're putting less stress through the tissue compared to massage. So yeah, you can use that in the acute phases of treatment.
That's very interesting. And so another thing in your toolbox obviously is stretching. So how would you know which stretches, or how do you recommend which stretches for which injury?
And that falls into obviously the exercise part.
Yeah.
So you've got the treatment, you've got the exercise part. Generally, the exercise part is very important in physio. If you want to change someone's tissue, you've got to actually implement some exercise long term, so the patient's not coming back after 6 weeks of having their manual therapy. So manual therapy will provide a very short-term relief, and it'll also provide us a window to exercise because we can reduce the tension in tissue. So then we give you the exercises. So we break the exercises roughly up into stretching and strengthening. Generally nowadays you're going to focus more on resistance training. What research has shown us is tissues generally don't get tight, they either turn on or off. So within a large, think of the body as in small muscles that stabilise us, postural muscles, fatigue resistant. The only way we exercise those is by sitting well throughout the day, standing well throughout the day, and those muscles don't get tired, they don't get fatigued, they work all day. Then you've got the big muscle groups that get tired. These are the muscles that are designed to move us, designed to twist, turn, lift weights and things. So what happens when we sit in front of a desk all day? Generally gravity will pull us down and it'll put stress on tissues. If we don't have armrests on our chair, we'll start to stress through the shoulder blade, through the neck. So those big, long, beautiful muscles that help move and sort of exercise us, they'll get stretched. And as they get stretched, they increase in activity, so we start to develop trigger points, and then we also start to reduce the blood flow in those muscles, so then we get pain. Right. So the last thing you want to do is go and stretch them more. Even though you get a short-term relief from stretching, the reason you get a short-term relief from stretching is pretty much you've stopped staring at the computer and all you've done is put a neural input into that muscle because you stretch it and it'll feel good. Long-term, you're actually doing more detrimental effects to the muscle. So that's why it's very important to see a physio, and part of our treatment will always be implementing some form of exercise-based treatment, which nowadays can be a wide range of things. We're not going to get you to join a gym if you don't like the gym. We've got apps available to us. We've got home equipment we can buy. You can buy kettlebells to have at home, TheraBands, which we use a lot, gym balls, medicine balls, all these different types of equipment, which is quite easy stored at home. And if you get a proper program by an exercise specialist, just doing 10 or 15 minutes a day can make a huge difference.
Fantastic, yeah, this is so interesting, thank you. And the spinal manipulation, I know you bring into your therapeutic practices as well.
So that's just the way we've talked about muscle, releasing muscles. Obviously, along with sitting poorly and posture-related pain, you're going to put stress on joints. And the main joints in the body or in the spine that we look at are obviously the discs, which are the shock absorbers, okay, so they compress. So when we look at the average human, 70-80 kilos, you're going to roughly put an extra 10 kilos of pressure down on those discs when you sit compared to standing. And as they get squashed, and obviously we lose a bit of water content from them, you're going to start to put pressure on the joints at the back, which are called facet joints. And these facet joints are joints just like ankle joints, elbow joints or anything. So once you start stressing the disc and the facet joints, the joint becomes stiff. And then when you sit poorly, and then you start elongating all the muscles through here, you end up with just a stiff back. And the main areas that would get affected is the cervical spine, where when we're looking at a computer screen, obviously the computer screen draws our head forward, and if you think of all these joints in the neck that are sitting there getting stressed and stretched over time, the mid-back, which gravity pulls us down and increases the curve, and then the lumbar spine where we actually lose the curve and we start to flatten the spine. And all those different stresses throughout the day will cause joints to be stiff. So mobilisation and manipulation is a way of loosening that. Mobilisations is pretty much It's a technique we use to loosen joints but in a comfortable way so the patient can stop it. And manipulation is more of a thrust. It's the clicking of joints, which generally most of us have experienced. That's a technique where the patient can't stop it. It's more of a dangerous technique. So usually what we'll start with is mobilisations first. And once we get to know the patient, know their spine, if it's beneficial, then we can move on to spinal manipulation. And the only thing with spinal manipulation to bear in mind, the clicking of the joint or the cavitation of a joint is actually just splitting the joint apart, and that causes roughly 20 minutes of muscle relaxation afterwards, and that's why we feel a little bit of benefit.
Okay.
But just remember that's short-lived, and if you don't do the exercises and stuff, it's a waste of time getting weekly manipulations, because you're not going to change anything.
Yeah. So many people start well with their exercise, don't they? And they gradually tear off.
Yeah.
It's important to try and keep those going.
Yeah, exactly, yeah.
And I know you use taping as well as part of your treatment. Can you explain a bit more about that?
Yeah, so taping for postural related issues and spinal pain we use as a proprioceptive feedback. So what that means is generally proprioception is the body's awareness of a joint in space. So I can close my eyes and I can say my elbow joint's at 90 degrees. And the reason I can say that is we've got all these receptors in our muscles, joints, ligaments, tissues that feed back to the brain, tell us where we are. So with spinal pain, when we're sitting like this all day, the body becomes used to this. We think this is normal, but this is stressing things, and we only worry about it when it becomes painful. So taping is a way of actually just strapping muscles and joints into a good position, so the muscles start to realise what that good position is, the proprioceptive feedback, and then over time we'll start to get used to holding the muscles in that position. So for taping, if you're going to tape someone with postural pain, you want to try and tape them for about a month, and they've got to work with the tape, and as soon as they start slouching, the tape will pull, the skin receptors will feed back to the brain, and it'll just make them more aware of their posture. So you use it as a technique not to support or not to change, it's to help muscles find out where the correct position is for them when they're sitting at a desk or moving.
Okay, so interesting, not just for sports,
No.
as well as posture.
Yeah, definitely. And you've got two types of tape, just quickly briefly touch because people will see this tape. You've got K tape, which is movable tape, it stretches, and then you've got brown tape, which is called leuco tape, and that's rigid. So depending on whether you're trying to stabilise or more support joints, might use the brown tape, and if you're trying to provide proprioceptive feedback, you might use the coloured tape or the K tape.
Thank you so much, Cam. That's been extremely useful. I've learned a lot, and I hope you too have enjoyed this and found it very beneficial, and that you'll join us again at our next episode of Back Chat. In the meantime, take care.